All right, everybody, welcome back to We Are Austin. We're letting you know how you can get those pearly whites shining bright yet again. Having a receding gum line, though, can make a person look older and lead to tooth loss and make it difficult. So many people avoid getting their gums fixed because it might be a little bit too painful.
That's right. Well, one dentist developed a way to fix receding gums using a minimally invasive technique. Joining us are Dr. Chao and Dr. Corinne Scalzitti. Thank you both for being here.
So happy to be here.
It's nice to see you.
It's nice to be here to talk about something that's like surgery, but it's not surgery.
Right,
Absolutely.
exactly. So, Dr. Chao, you invented this procedure. Before we get into the specifics, let's talk about receding gum line. Why is it even important?
Well, receding gum line means that you're losing bone and losing gum, and it can lead to decay of the roots and eventually loss of teeth, but it's all preventable. Up to now, there is the grafting technique where you have to take a piece of gum from the roof of the mouth and then tag it on the way you need it. But now we can do it differently.
And this is huge.
This is the other technique, the conventional technique where people don't want to go.
Right.
They don't want to go there because you have to cut the gum and then put that piece of gum right over where you need it. Well, people are afraid of that.
Yeah, that
so now
intense.
I've invented a method where we go through a little pinhole in the gum. And
so this is completely different.
Completely different. We don't use cutting. We don't use stitching. Through a little pinhole with special instruments that have been taught to 800 dentists across the country, and we can now move the gum line down. We loosen it up from the binding underneath, and slowly let it drape down to where it belongs. And then, once it's down, then we can, through the pinhole, put little collagen strips in there, and then that's it. And when it's done, you can hardly tell it's done. It's like gums has grown in just one appointment.
And it doesn't go back. It doesn't go back.
It doesn't go back, and it's a permanent fix.
And you were saying how this is minimally invasive. What did you call it?
I call it a huggable procedure.
A huggable procedure.
It's a procedure that gives us a lot of hugs.
Because people are very happy.
Yeah, you don't do surgery generally and get hugs.
Right.
But we do with this one because it looks so natural. It's really an inspirational thing to do for the patient.
Absolutely, and I know, Dr. Scalzitti, you offer this to your patients here in Austin. Why did you decide to start doing that, and what's their response been like?
I was so thrilled when I heard that there was a technique different from grafting that I couldn't wait to take the course. And Dr. Chao is the most wonderful teacher. He just really makes sure that you do it his way when you walk out the door, so you're very competent.
Yeah.
And you have some patients that you've done this on. You want to tell us about some of them?
I have done it on wonderful patients. One man, Jason, who has an infectious personality, worked in Iraq, and he was going back the next week, and when he heard about it, he wanted to do it immediately. So we did. I got to see him one day afterwards, and he had this huge grin. And he said, "This is my money smile."
Yeah. That's so great. And of course, that made you feel so great about the whole thing.
Not only
did he give you a hug afterwards, what did he give you?
I got a hug, and then on the way back to Iraq, he managed to order a fruit bouquet for us.
A fruit bouquet?
That's so sweet.
There's the huggable procedure
for you.
Very huggable.
And another patient that you took care of recently?
Lisa came in. She had needed it for years. She knew that she did, and she had avoided it because she was afraid it would be painful and she'd have a lot of downtime. She came in, and when we handed her a mirror at the end, because the results are instant, when we handed her the mirror, she had tears come to her eyes, and then she just could not stop smiling.
With tears in her eyes?
Yes.
And Dr. Chao, you said you can actually eat later that day.
Yes, you can eat.
Good to go.
There's no pain afterwards, and it looks normal the next day.
So we have before and after pictures. Let's go through some of these. You could actually see the receding gum line on the left.
You can see the receding gum line. That's all done in one day. And you can hardly tell because we don't cut it, we don't suture it, we don't stitch it. And this is a full mouth case. Upper and lower we were able to do.
Why do we even get receding gum line? Why does this happen?
Overbrushing, gum disease.
Okay.
A lot of times it's overbrushing.
And so it sounds like you've been training doctors all over the world in this procedure. If someone wants to find how they can locate a doctor here in Austin who's doing this, how do they do that?
They can go to my website, pinholeacademy.com, and find dentists there, they're certainly welcome to see Dr. Scalzitti.
Of course, she's making patients very happy day in and day out.
Yes,
We would be delighted.
Yeah,
That would be great.
Well, thank you guys so much. And of course, there's all the information you need on the screen. Thank you for sharing your story, and thank you for making people smile and get their confidence back. It
Dr.
sounds like
Chao,
you're doing a lot
good
of that.
job.
Now, I understand you have a problem too.
I
yourself.
do. We're talking about, my doctor has been saying, Jordan, there's an area in your mouth that we're keeping our eye on, and every time I go, I've got a checkup coming up, I get worried.
Can we do
I
it now?
don't want to go through the, I don't want to do the skin graft or the gum graft. It scares me, right?
Yeah.
But now I know what to do.
We'll do that during commercial break.
Exactly.
How's that sound?
Yeah,
The
right
whole
now.
show is after break at the end of the show.
Thank you, Dr.
Thank you
Chao.
guys
you
so
for
much for
having
being
us.
here.
Thank you.